We used to fear bleeding for mothers being the leading cause of mothers' deaths. Now, preeclampsia is the leading cause for maternal deaths in Kawempe particularly. Out of every 100 mothers, 16 mothers will die because of preeclampsia. It does not only cause maternal deaths, but it is also the largest contributor of the babies that are born premature and the babies that die because of prematurity. High blood pressure we call preeclampsia, which is quite unique for pregnant mothers, is a pressure where we have a mother who has been having normal blood pressures even before pregnancy, even in the earlier parts of pregnancy, and then suddenly at 5 months, she gets 140/90 and above. And when doctors check her urine proteins, they can find that her urine proteins are high, or they can find when she has other complications along with this raise in the blood pressure. There are several categories of mothers at risk. High risk and those that are moderate risk. For example, first-time mothers, mothers whom in their previous pregnancy had high blood pressure, mothers who have a strong positive family history from their mothers, from their sisters with a high blood pressure, mothers with the history of blood pressure before pregnancy, before they conceived, they had this high blood pressure. Mothers who are diabetic, those ones who are diabetic are at risk of getting preeclampsia. Mothers who are carrying multiple pregnancy, twin pregnancies are at risk of getting this high blood pressure. And of course, mothers who have those poorly formed pregnancies, you'll hear us when you come to hospital, we tell you molar pregnancy. These are also mothers who are at risk of getting preeclampsia. And mothers who are obese, mothers who are obese, over 30, that is the 30 kgs per meter squared. So when we classify you as an obese person, you are at risk of getting preeclampsia when you are pregnant. And of course, if your husband had a wife who had a high blood pressure during her pregnancy, who had preeclampsia during her pregnancy, you are also at risk. And if you've had several children with one partner and then you change to another partner, you are also at risk of getting preeclampsia. There are some of us who actually walk around with this high blood pressure with preeclampsia, and we don't know. There are so many that don't show any signs or don't get any symptoms that they have high blood pressure. However, there are those signs that also come and you can recognize that these are signs of preeclampsia. For example, this persistent headache frontal through your eyes, and this headache is not going away by painkillers. Visual disturbances, you are seeing blurs, dark spots. If you get this pain in your upper abdomen, many people will interpret it as ulcers, but in pregnancy, that pain for a mother who is 5 months and above is the common indicator of preeclampsia. We also get other signs like convulsions with these mothers who are having a preeclampsia. The legs swell, the hands swell, become yellow, depending on the degree. If you see some of these signs and you first wait at home, eventually other signs will come to present themselves. It is a disease that targets our liver, so we shall end up with the liver injury. Our kidneys, you find yourself that you cannot produce enough urine, and then you know that your kidneys have been injured. For the liver, you'll see that your eyes have become yellow. And such a person who has preeclampsia, the complication can be easy tendencies of bleeding. You find a mother starting to get bleeding gums. When they cannulate them, the cannula site continues bleeding. And if such a mother goes in labor and gets bleeding after birth, this bleeding becomes continuous. The good thing, this condition is among the preventable causes of maternal deaths. So one way to prevent this condition is to do early antenatal care attendance. When the pregnancy is about 2 months, their blood pressures are checked on a regular basis. Actually, this helps us to intervene early and prevent the complications of preeclampsia. The other way we can prevent this is to start you early on treatment so that you don't develop the worst form of this disease. In the event that the health workers go on and they check your functioning of your liver, functioning of your kidney, the well-being of your baby, and checking your levels of blood, and then they find this compromise, then the doctors will propose that it is very important to deliver this baby at whatever point of age that pregnancy is. Men, husbands, fathers, you have a big role to play in this. These mothers need to attend antenatal care early, and then you support them and escort them there and be able to provide for them when they need medication. You give them their medication.